This is a natural dietary supplement extract from tropical sorghum biocolor, researched, refined and confirmed as a powerful antioxidant. It will increase your blood to required levels and boost your immune system rapidly. Jobelyn improves the fertility rate in both men and women. Jobelyn protects and provides energy for mother and child all through pregnancy and at childbirth. Jobelyn purifies your blood. It deters and effectively controls chronic heart diseases and blood-related conditions like hypertension, arthritis, diabetes, sickle-cell anemia, stroke, and even HIV and AIDS. Daily intake of Jobelyn protects the body from infections and guarantees a healthy and happy family. Jobelyn has no known adverse effects. Produced by Health Forever Products Limited, Dikpeolu Street off Obafemi Awolowo Way, Ikeja, Lagos, Nigeria. Available in sachets and capsules for adults and syrup for children in all leading pharmaceuticals nationwide. Consult your physician for prescription.
30 capsule Jobelyn now comes in a new pack.
Live healthy. Live Jobelyn.
A patient who has mild malaria will feel irritable, he feels uncomfortable, he's sometimes waking up and sitting down and lying down again and moving all over the places and start to suspect malaria. And in severe cases, these conditions worsen. Because of the serious destruction of red blood cells, the patient develops anemia. And mind you, anemia is not as simple as you think about it. It's not as simple or as just pallor of the eyes and the palms and the skin. Severe anemia could lead to heart failure and death. A patient who has severe anemia cannot eat because he vomits everything. Because of persistent vomiting and inability to eat food, he is seriously dehydrated. You need to see children who are in the state of severe malaria. You notice that they are so weak because of the low sugar content of their blood, and because they have become dehydrated, they cannot even stand on their feet. And worrisome is also the situation when these malaria parasites cross the blood-brain barrier and invade the brain, causing what we call cerebral malaria. When this happens, the patient is in a condition of stupor, he's confused, he's almost collapsing, he's almost becoming unconscious. His fever is very high, so high in some cases, especially in children, that convulsion, that is the complete rigor of all his muscles, occurs. And I want to draw a note of warning in this case of very high fever, which leads to convulsion. Please don't put all kinds of metal spoons and what have you into the mouth of this patient. Quite often, the tip and the tongue of this child is injured. All what you need to do is just to put a stick or a plastic spatula between the teeth so that the tongue is not beaten. Like I have said, there is a heavy destruction of red blood cells which is observed. As a result of this, the content of the red blood cells, that is the hemoglobin, turns into bilirubin and flows into the blood. And you notice that the blood of these children or this adult who have heavy destruction of red blood cells, who have become anemic, their urine simply turns into what I would say Coca-Cola urine, almost black. And when you see that, you know that the attack of malaria is very, very serious. In fact, a patient who has undergone this severe anemia of malaria paints a picture of a dying patient. Please don't keep this patient at home. Don't carry this patient to the church. Rush this patient to the nearest doctor for serious medical attention.
So many anti-malaria drugs in the market, yet so many deaths still occur. The Nigerian government recently released guidelines towards the management of all forms of malaria. What are these?
We thank the NAFDAC people very much for drawing our attention to the fact that chloroquine and the pyrimethamine and sulfonamide combination, we know the examples as the Fansidar type of drugs. It's claimed that they are no more effective. But the surprising thing was that 6 months after the introduction of what was claimed to be effective, that is the artemisinin single drug, the artesunates, 6 months after their introduction, it was claimed that the artesunates were no more effective. And the introduction of the so-called ACT therapies, the artemisinin combination therapy, was introduced. So it means nowadays the only effective, commonly used anti-malarial medicine, they are called the ACT, the artemisinin combined therapy drugs, which contains basically artemisinin combined with other antimalarials like amodiaquine, mefloquine, lumefantrine, so on and so forth, and even recently artemisinin combined with Fansidar type drugs have been introduced and claimed to be the most influential, effective in the management of malaria. Now, I want to draw your attention to the treatment, other medications that are given alongside the ACT or the quinines. I have discovered that Jobelyn has by itself a little anti-malarial effect. Apart from that, as we said, the dangerous side effect of malaria is serious anemia. And knowing fully well the very good effect of Jobelyn on anemia cases, I will suggest to all my colleague practitioners that whenever you are treating malaria, please try to introduce Jobelyn for the prevention of anemia. And moreover, we have confirmed that Jobelyn has anti-inflammatory effects by the suppression of cytokines. And you know very well that it is the cytokines that these malaria parasites produce that cause the aches and the pains and the fever that affects the malaria-infected patient. So, my dear colleagues and everybody generally, I will suggest that introduce Jobelyn alongside your normal antimalarials, and you will have a very improved patient at the end of the day. Now, the question is, for effective treatment of malaria, use this as your watchword. Always give the correct treatment that the federal government's guidelines have indicated. Always make sure that the dosages are correct, and always make sure that the duration of the treatment is applied as recommended.
To prevent convulsion and save the child's life, you must bring down the fever immediately. How do you go about this?
Fever is a very horrible condition. In fact, it is the main condition, apart from the anemia, that kills the patient. So we should endeavor, especially in children who have developed very high temperature, because the next thing that occurs to them is that they convulse, and quite often during this convulsion, death can occur. So the first thing you want to do is to reduce that very high fever as fast as possible, and that is very simple. Remove all the child's dressings, expose the child, and if you have a fan around, direct the fan at the child. Put the child in a bath if you can do that. You don't need to put the child in ice-blocked waters. All what you need is a lukewarm or tepid water, and this with time will reduce the temperature of this child. If you have paracetamol around and the child is not unconscious, please give this child some paracetamol or any medication that will reduce the fever. Let the child drink a lot of fluid. Like I said, one of the dangerous conditions in the child is the dehydration. So please try to rehydrate the child as fast as possible. Don't forget, the child or the adult vomits a lot. Whether it's child or adult, if the vomiting is persistent, try to introduce the oral rehydration therapy. Best or better still, if you can get the packaged one called Oracell, please introduce it as fast as possible.